My name is Patti Massa. I'm a care manager in the Eastern office of CCCI. I've been working there for 6 years. I'm going into my 7th year. I went to school. I graduated from the University of Southern Maine in Portland. I like the elderly population. I like working with the providers. I like the field in general, and I like CCCI. I have to say it's been a really incredible place to work. I think what I do in the role of care manager is really kind of a liaison between the family and the people that we serve and services. Kind of a face to the home care program for elders in some ways. People wanting to stay at home, they have questions about how to do that, and I'm kind of the go-between. Whether it's the benefits for the state of Connecticut, whether it's getting home care providers, answering questions about Medicare D plans and where to point them in the right direction, that sort of thing. Our initial assessments take about 2 to 3 hours, 2 hours usually maximum, but that's when we go out and do an overall health care assessment, what their health issues are, what their function level is. We talk about their finances, whether they qualify for Medicaid or whether it's the state-funded portion of the home care program. Talk about long-term planning. Is the wish for them to stay at home? What's the backup plan if this doesn't work? Kind of, you just get people to think in terms of what they want, how can they get it, and if that doesn't work, what's the next step? One of the biggest rewards I get from working in this job is working with some of the family members who are caring for their elderly parent at home that has Alzheimer's or some form of cognitive limitation. So those kind of connections between the caregivers and their families are really strong, and when you're a part of that and you get to see that, it's special. I enjoy working with providers and having case conferences with other people involved with the clients, whether it's providers or conservators or what have you, discharge planners, because we each see the client from a different angle, and then when you get in the room and you can kind of bring it all together, it really helps the plan come together. It helps bring the focus to a positive note of what can we do, and instead of, well, they can't do this, so I don't know who's going to help them. Everyone's just there at the table at the same time, which is helpful. A suggestion I could give to a caregiver just starting out would be to pace yourself. Definitely. You don't know how long the health issue is going to last. You don't know how long the person's going to be able to stay at home, and sometimes it's almost easier to go in and do everything yourself. But if you look at the bigger picture and you want them to stay at home, it's best to get people involved, other people involved, to help care for your loved one. Because if you aren't available or something happens, then they have someone else to rely on. And for yourself, you have to pace yourself, and because it's hard work.